Hello. Hello, viewers. This is Practice with Puspen video edition. We will now switch to the video format, and this will help you how to practice via Zoom. And also, in your actual exam, you'll be able to look at the facial expressions of the patient and vice versa. So facial expressions also are extremely important. Dr. Preetha Ghosh has graciously joined us. She will soon be appearing in MRCS ENT OSCE. And we are practicing manned stations, the communication skill stations. And this is the question for the benefit of the viewers. I'll just read it. A 45-year-old man is complaining of difficulty swallowing. So the task for the doctor is to obtain relevant history and discuss differential diagnosis with examiner. So in this situation, I'll play the role of both the patient and the examiner. Dr. Prisa Ghosh will play the role of the doctor. In the exam, you will not be allowed to look at the question while you are communicating. So you'll have about 7 minutes if you have a prep station to prepare for the station, that is the test station. In the prep station, you'll be looking at the question and gathering your thoughts and preparing how to approach the station. So please don't make a mistake of missing out on some important detail because you'll not have a chance to look at it again. Again, it is imperative that you practice communication skill stations with a suitable practice partner as much as possible, because I feel this is the station, these are the stations where the wheat is separated from the chaff. So please don't make the mistake of not practicing adequately. So with that out of the way, now we will start the practice with the Pushpen video for today. This is the history taking video. So Dr. Preetha, if you are ready, I'll start the timer and I'll stop sharing the screen.
Yes.
Okay, so your time starts now.
Hello, I'm Dr. Preetha Ghosh and I am an ENT doctor in this hospital. May I speak with you?
Yes.
Could you please tell me your name and date of birth, please?
My name is Tom Anderson and I'm 45 years old.
And how may I address you, Mr. Sir?
You can call me Tom.
I see, Tom. Well, so Tom, I see that you are having some problem with your throat where you feel as if there's a lump. Could you please tell me in details what exactly is happening?
I mean, I wouldn't really describe it as a feeling of a lump, more like I have difficulty swallowing, and I have had it for about, I think, 5 months now. And it's really annoying. I can't really say when it starts or when it goes away. It just comes totally unexpected, and it's really making my social life in particular quite difficult. So I'm really embarrassed about it, actually.
Well, I'm so sorry to hear that, and I can understand this must be a really worrisome and a concern. We'll try our best to do whatever possible to help you get better. Is it all right if I ask you a few more questions?
That is totally fine. Yes.
Well, is it this feeling or this difficulty, is it there throughout the day? I mean, throughout?
Um, I don't really, I don't think it's there throughout the day, but it does increase sometimes. And I really can't predict when it will happen. That is the really bad thing I feel.
Okay. And do you feel that does it improve with eating?
Um, it doesn't always interfere with eating, but sometimes I find it especially difficult to get things down, especially the lumpy stuff. The meat,
The solid,
especially.
you mean?
Yes, and especially the lumpy solid food. I find it
All right.
particularly difficult to swallow it mostly. Yeah.
And is there pain while swallowing?
No, no pain.
And do you, all right. And do you get these recurrent bouts of cold or sore throat?
Not really. No, I don't.
And have you noticed any kind of change with your voice
No, I haven't.
or any kind of problem with while breathing?
No, I have no trouble breathing.
And would you say that you get heartburns very often?
Yes, I've been having it for the last 20 years now.
Mhm. All right. And were you taking medications for your heartburn?
Not really, no.
All right. And do you feel that you get regurgitation of food, like food comes up?
Yes, now that you mentioned it, I really should have mentioned it to you in the very beginning. I have these episodes
Mm-hmm.
where undigested food comes up, and it's really embarrassing.
Oh, that must be really concerning. Well,
Yes.
we'll look into that as well. So, are you generally well? Uh, in sense, like, do you notice any kind of fever
No fever, no.
or any kind of unintentional weight loss
No, I haven't had that.
or 99 sweats?
No,
Do you notice any kind of swelling in any other part of your head or neck region?
no, I haven't.
All right. And is there any kind of pain that goes towards your ear
There is no pain, so no pain in
at
the
all?
ear.
All right.
Yeah, no
All right.
pain.
So, and are you anxious at this moment because of this problem?
Yes, I'm particularly anxious. So it's, as I said, it's really embarrassing for me, especially in social gatherings. So yes, I'm
I
really
understand.
concerned.
Well, I understand. So, do you take any medications for any chronic illness that you may have?
I don't have any chronic illnesses. I'm not on any medicines, no.
And are you allergic to any medication?
I'm not aware of any known allergies. Yeah, I don't think I have any allergies.
All right. I would like to ask you a few more personal questions. Is that all right?
I mean, is it relevant to this discussion?
Yes, it is.
Okay, go ahead.
Well, I don't mean to scare you or alarm you, but this is just part of the questioning here. Does anyone in your family have any history of any head neck cancer?
No, but I think I might be the first one.
Well, I do understand that this must be worrying you, but just having the sensation doesn't mean that there's something sinister going on. We will look into it and we assure you that will help you get better. And do you drink?
Occasionally, when I go out with friends, yes.
Do you smoke?
Yes, occasionally I do.
And what do you do for a living?
I'm a tourist guide.
I see. So to sum up, you're having this problem of difficulty in swallowing for about 5 months now, and you do have heartburn and some regurgitation. Apart from that, you haven't noticed anything specific, and no one in your family has any similar history or any history of head neck cancer. Well, we'll do some examination to know exactly why this is happening. So the differential diagnosis here could be a pharyngeal pouch. It could be gastroesophageal reflux disease. It could be laryngopharyngeal reflux disease. And the rarer causes could be any kind of supraglottic growth or a supraglottic malignancy. And that's all about it. Thank you so much for your time.
So, in this list, which one would you consider to be the most likely diagnosis?
The most likely diagnosis would be a pharyngeal pouch because the patient says that there is regurgitation of undigested food, which would be a very probable diagnosis here.
And how would you confirm your diagnosis of pharyngeal pouch?
Well, we'll do a barium swallow.
Hmm. And what would you see in the barium swallow in pharyngeal pouch?
We would see a pouch that is which is known as a Zenker's diverticulum, which will be pouching out of the inferior constrictor.
Okay, so that is the time, and I think it was a very well negotiated station. However, I will not be recording the feedback. And okay, I hope this video helped the viewers on YouTube. Bye bye.